I think as well as all of the others up here, we've been meeting daily, basically, for many hours out of the day, looking at the patient population that is coming out of the Prevea clinics and trying to ramp up the things that we do for those patients as outpatients. In the hospital setting, we're having discussions with the other healthcare facilities in the marketplace, the Mayo system in their hospital, the Marshfield system in their hospital, the Oakleaf Surgical Hospital, and just trying to look for ways to create bed space. We feel like we're going to be losing at least 100 beds that are used on a regular basis that we're going to need to replace, and that's where our focus has been. In particular, when things like this happen, one of the kind of disease states that is really important to be able to respond to is emergencies where cardiovascular disease, heart attacks, strokes, that sort of thing. Time is of the essence, and we're losing a very important ER in Chippewa Falls at St. Joseph's that we're looking at the fact that just the transit time from up north is going to make it difficult to sometimes be able to get those people where they need to be in a timely fashion.
Okay. And moving on to Mayo Clinic Health System, how can Mayo Clinic handle that increased patient load?
So thank you, and we want to thank everybody for coming tonight, and we understand everybody's concern. At its core, our challenge is how do we care and how do we serve for patients safely, especially during this time, because we are very committed to patient safety. When these announcements happen, we put together sort of an incident command structure to go through all of our various facilities and see what we can do at this time to maximize the capacity that we do have. We consist of what we say one hospital with 5 doors, because we have the hospital in Eau Claire and then our 4 critical access hospitals in Barron, Bloomer, Osseo, and Menominee. So that we think that we can staff an additional 20 beds at our critical access hospitals to add to the bed capacity at this point in time. Our oncology group has been in close communication with HSHS Oncology Group as to how we can transfer and care for the oncology patients that they have at this time. You may be aware we started a couple of years ago what's called an advanced care at home program, which is sort of home hospital, and we're planning to ramp that up and expand the capacity of this at that time. And then we are collaborating with our Mayo Clinic Health System colleagues in Southwest Wisconsin, in La Crosse and Sparta, so that we can fully utilize their facilities as well. We understand everybody's concern. Also, we need to realize that everybody in the community can help at this time too. There's other ways to access health care. We have developed video on demand primary care or through patient portals and that sort of thing. So especially during this time, it's important to utilize healthcare facilities in every way that's possible.
Sure.
I'd like to see if Ken had anything to add to that.
I'll be very brief. First, thanks to everybody for attending tonight, and thanks for hosting this. This is an important conversation. The only thing I'll add to Dr. Helmer's statement is the fact that undoubtedly there's a lot of concern about emergency services in the area. Fortunately or unfortunately, we did endure a worldwide pandemic several years ago, and this area did a fantastic job. And Mayo Clinic, I was in Rochester at the time, but Mayo Clinic up here did a fantastic job of scaling those services to care for people, and we're taking those lessons learned and we're applying them to this situation as well. So thanks.
Right. And what about Marshfield Clinic's availability?
Sure. Excuse me. First off, again, thank you to the Chamber and WEAU and all of the folks in attendance and those online. We appreciate everybody's engagement with this challenging situation. I guess first off, like others, we were surprised by the announcement, and it's never easy when we have a large system preparing to exit the community. But similar to Mayo, upon hearing the news, we pulled our senior team together and quickly evaluated our capabilities. And when we really look at the magnitude of the potential change, we too pulled together our incident command, similar to Mayo. We utilize that for it's a rapid response structure that allows us to, for natural disasters or other significant events, not unlike this, and again, similar to what we did during the pandemic. So we meet as well daily, planning, looking at things that we need to address and how we can find solutions similar to create capacity. We've really looked at three areas predominantly at this point. We can continue to evaluate, but really looking at how do we increase our urgent care capacity, particularly in the Eau Claire and Chippewa Falls community. How do we increase our ED capacity in Eau Claire, where our hospital is located? We're also working closely to scale up additional beds to accommodate the increased demand for women's health services, particularly obstetrics. We know there are a number of moms that will need a place to deliver. And so we're also exploring ways to really leverage our network of hospitals and clinics. We have locations in Ladysmith, Neelsville, Rice Lake, Eau Claire, as well as surrounding clinics. So how do we utilize similarly those beds and maximize the use and look at making sure we're doing everything we can, not only in Eau Claire and Chippewa Falls, but in our surrounding communities and our broader system as we think about Marshfield, Wausau, Weston as well. We also understand this situation obviously is fluid, and with the announcement and what we've heard tonight, but we continue to explore every option to ensure that we have a structure in place along with our other partners in the community to ensure that we are able to take care of the patients in the community and really do all that we can to address the healthcare needs.
Dr. Hernan, do you have anything to add?
Very little, very nice summary, Brad. And no, we definitely appreciate the opportunity to be part of the panel tonight and have the discussion and start advance the conversation with the stakeholders for the situation that's come up. The pandemic did teach us to be flexible, and so we, with our resources that we have, with our facilities, with our surrounding facilities, we can flex to the volume, and then we'll look for those resources to free up the emergency department. I'm an emergency medicine physician. We look towards how we can potentially use some of that urgent care capacity to keep the emergency department for those things that really need to be there, that higher acuity care, and then have the faster, less acute care in other locations, either on the campus or elsewhere in the region. We have been focused on this and meeting daily for the last 2 weeks, and excited to have more conversations with all the stakeholders.
Sure. According to a report out last year from the Center for Healthcare Quality and Payment Reform, more than 600 rural hospitals in the country are at risk of closing. Let's start with Dr. Artesensi. There are a myriad reasons for this, but I guess what is at the heart of this? Is there a root cause?
There really are multiple causes, and even though the situation the Chippewa Valley is dealing with right now feels kind of maybe to a lot of people like it came out of the blue, these are challenges the healthcare industry has been facing for decades. Healthcare costs increase. We love medical advances, but they come with a price tag. We've had nursing workforce shortages for decades. We have an aging population. 10,000 people a day turn 65 in this country, and we're living longer than ever. So the demands on our healthcare system are higher than ever, and we live not as healthy of lifestyles as we maybe otherwise could. So that leads to higher costs as well. A major problem is the way that we pay for care in this country. We don't have a national healthcare system or program, but the majority of healthcare services are paid for by Medicare and Medicaid, which are funded through taxpayer dollars. And those programs routinely underfund the cost of care. On average, Medicare underfunds by about 10%, and in Wisconsin, Medicaid underfunds dramatically. In hospitals, they underfund about a third of the cost of care. And hospitals in Wisconsin have 70% or more of the patients whose payer sources are Medicare and Medicaid. So you don't have to be a mathematician to say, hey, if 75% of the people I'm providing care for, I'm not even getting my costs covered, that's going to be hard to be a sustainable model moving forward. There's been a shift to save resources, overall by moving from inpatient care to outpatient care. That's great for the outpatient providers and it's great for patients, but it's challenging for inpatient providers like hospitals and long-term care facilities. So those challenges all existed even before the pandemic. And then with the pandemic, we have had significant challenges layered on top of that. All of us know that everything costs more today than it did a few years back. And I think the staffing staffing challenges have really been exacerbated. We have a lot of burnout, we had retirements and resignations relative to the pandemic, and we have tons of overtime costs that are being paid to try to fill the gaps in the schedules for staffing challenges, and paying agency fees and traveling nurse fees. I mean, it's wonderful to have those available in the time of a crisis, but if you're paying triple the cost of wages to sort of fill a gap, that's a temporary measure. It's not a long-term financially sustainable solution. And there's a lot of competition from non-healthcare providers, right? A couple years ago, my teenager got their first job and got paid $8.50 an hour. And now my 16-year-old got his first job and got paid $15 an hour. And so there's a lot of people employed by healthcare systems and hospitals that are not people with professional licenses. So if they can turn around and work at Quick Trip or Dollar General for $5 or $6 more an hour than they can make working in healthcare, that's a challenge. And because government reimbursement rates are set by the government, hospitals are not nimble enough to be able to just raise their prices to offset those increased expenses.
Well, thank you so much for that. We did receive dozens of questions along with the Eau Claire Area Chamber of Commerce, and let's bring Alex Loroff in here right now, and we asked for the questions, and you've got a question.
Yes, sir. We received dozens of questions from the community, and Shakila asks, how will adolescent psychiatric needs be addressed? There's already a shortage of providers nationwide with limited inpatient beds, and HSHS was the only inpatient provider in the area. So let's hear from the providers on this. Mayo Clinic, if you could start with this, just how will that be addressed going forward?
Thank you. That is a really great and important question, and I wish I had all the answers. Certainly behavioral health is a real challenge. 1 year ago, we decided to increase the size of our inpatient behavioral health unit because of that reason, and we have maximized the number of rooms that we can provide. And it's other efforts like that, video health, telehealth, those are the things that I think are going to answer this. But clearly it is a problem. Again, we've expanded our inpatient bed capacity and are doing all that we can do to try to help with this.
Mm-hmm. Anything else to add from Marshfield and Oakleaf on this topic? Or?
I would just add that this is a hard question with no clear, simple answers. Clearly, as the question highlighted, there's a national problem with inpatient behavioral health care. One of the things we've looked at, or that we're aware of, that there are other clinical groups, including federally qualified health centers, that have been successful in being part of the answer in other communities that have faced similar problems. We also work closely with school-based interventions and provide support to school districts to create more avenues of engagement. I think we too wish we had an answer, but I can tell you that this is an area that will require a lot of attention and a lot of cooperation and working together as a community, but we need to get this right. This is a very significant need in our community.
I think from an Oakleaf Medical Network perspective, we've been there, the unit is there, the sisters are leaving the marketplace, but that mission and ministry that the sisters had, that they came in 1875, and for 139 years they were a hospital that was oriented towards their community, listened to their community, looked at what their community needs were, and responded to that. And our interest really is trying to get people in the community who are used to that kind of behavior on the part of the hospital and talk to the community about keeping that hospital open, keeping that unit that's there running. It seems actually like it's fairly simple, and we believe it's a doable solution, and are interested once again in moving forward and exploring that with HSHS.
All right. Well, the HSHS Prevea Recovery Task Force met for the first time this past Tuesday. The task force was formed by the Eau Claire, Chippewa Falls, and the Menominee chambers, and we're going to bring in the leaders from all of those chambers in right now.
Thank you for having us. It's always a pleasure when we can partner together with our communities to bring people together to share information that's going on. My name is Dave Miner. I'm the president and CEO for the Eau Claire Chamber of Commerce.
My name is Ashley DeMuth. I'm the CEO for the Menominee Area Chamber and Visitor Center. And I'm Allison Wisniewski, the President and CEO of the Chippewa Falls Area Chamber of Commerce.
So one of the things we want to talk about is the task force that we started last week to, again, gather information, but to be able to share that with our communities, but more importantly, to ask you the questions of what is it we need to know to help solve the problem that's in front of us today. So if you go to any one of our websites, you will find a bar on there that will lead you to the task force website. And on there, you're going to be able to find one of 3 areas you can gather information. So you can sign up for a committee. They're clearly designated, a little bio on each one, and talk about what your skill set can be for us to help us solve this. You can also register for the newsletter that's going to be coming out. And we will be communicating in every way that we can, because not everybody consumes knowledge today, information all in one way. And then you can also continue to submit questions. Those are vital for us to understand as individuals, what are you facing? What are you up against that we might be able to find and get you that answer without maybe having to make 15 different phone calls. So I'll let my counterparts talk a little bit of what else we're doing.
Yeah, and I think it's really important that we recognize that all of our communities have unique challenges as well as opportunities. And one thing that is happening, I know with Chippewa Falls as well, Menominee and Dunn County will also have a specific group that will be addressing those unique challenges and opportunities for us, but also leaning into the task force, the regional task force. And our goal really is to create those subcommittees that are going to be goal-oriented, that we can come forward with tangible action items and really lean into the time, talents, and treasures and those individual expertise of the members of our communities.
And as Ashley and David mentioned, us too in Chippewa Falls and Chippewa County, with the loss of St. Joe's and Purveya locations, we are in a little bit different situation than we are here in Eau Claire, but also understanding what's happening regionally. How do we work together and really strengthen what the region is, and having the folks on this stage and having these parts of the conversation, it doesn't happen in a silo. So for us, having the conversation with our work groups for Chippewa Falls and Chippewa County, alongside of what's happening regionally, and us being aware we are in, I would say, regular communication with each other to understand how can we help each other out, what information do we need to know as a region, and what information is happening within our community. So really just looking at the strength and resilience of our community, how do we come together and really unpack what has happened and what we can be a part of. Chambers are really good conveners, and that is one thing that we do really well, no matter what the topic is, and that's where we see our value, is how do we bring people together to have the conversation and just to talk about and share the communication that's happening.
And we have a really strong partnership. We maintain a Chippewa Valley Alliance with the 3 chambers, and I think that we've positioned ourselves well to be able to collaborate, to really look at the magnitude of this, as Brad said earlier, of what that means for the Chippewa Valley. So as we look at workforce and community attraction and such, that'll all be addressed within the task force as well.
And as we look at the task force, I want to walk through it a little bit so everybody does understand it. Again, you can go to our website, you will see the breakdown of the committees. But we have, as of now, we just added another one today. We have 9 different lines that we're dealing with at the same time. So, and again, please remember, this is always about people. It's about the patients, about the employees, but when you break this down, it's always going to be about the people of this community. And I'll add this right now. What allows me to go home and actually get some sleep at night is literally the hundreds of people who are reaching out and saying, please tell me how we can help. I don't know what you have, I don't know what you need, but we want to help, please let us know. So again, if you're interested or want to help in some way, go to the website. So the committees really are going to talk about the patients. What are their needs? What do they need today? How do we take the information you give us, give to these individuals over here, and get that answer as quickly as possible to those individuals? But understand, we have a wide breadth of patients. Everybody who needs to have a prescription filled for blood pressure medicine maybe in May or something, to people who need to deliver babies. We got cancer, we have all of this. So it is we need multiple people to do that. We still have 1,400 employees we want to retain in this area. We need to see how we can work with them. You know, we've got still the employers and employees in our area. And again, this is going to affect all of our communities, as each one of these have said, in a different way. but we also can't forget the rural area, because this is not just HSHS leaving. We're losing the Prevea clinics in the rural part of our area. So this has an impact greater than I think still most people understand and truly see where this is going to go as it goes. I want to stress also the fact that this isn't going to be solved by the end of summer. We're not, we'll still be doing this probably come the end of the year, maybe beyond. So please have patience, communicate with us. But my one real request to you is to understand, please share the facts. Again, because we're dealing with people. We're dealing with people with now concerns, anxiety is up, stress is up. Make sure what you're sharing when you're at a coffee or the restaurant or whatever that may be with your family, that you do have the correct set of facts and of what we can do, what we're able to do, and as important, what we can't do. We're not going to be doing it all. Again, as we focus on the task force, we have those things. The steps that the Oak Leaf Network are taking, we're supporting that, but that's really their road to go down and focus on, and then if they hit something, to let us know, how do we help them? So we're not going to be able to solve everybody's problems, but we're going to do the best we can. But again, I just want to reiterate, the hundreds of people have reached out and said, we're here to help you, let us know, and we're all going to get through this in some way. So I'll let my counterparts, any final words that you want to both share, and then we'll wrap up.
I will just reiterate what Dave said. Please visit the websites. The link is on all three of ours. If you're not sure where to go with those questions, that's a great place. Staying in tune with that newsletter, as Dave said, we're looking at both short-term and long-term effects and opportunities on our community. So we can't guarantee how long this will last. We anticipate it could be years with the task force in different aspects. But get involved. If you have those questions, information exchange in the clearinghouse of this task force is one of its value propositions.
And I would say to support each other, however ways, right? I think we've seen some outpouring of support, whether that is a free coffee from Leinenkugel's Country, free Leinenkugel's. So just if there's ways that you could help support, offering a hand to a neighbor. We have friends and family who have been affected by that. And so I think just offering, maybe a shoulder to cry on or a hug, just remember to support your community. We're doing what we can to get that communication and work with our partners and people and share that information out. But please just remember to support each other, be patient, be kind, and we are strong and resilient, and we know that we will, we have a lot of great minds and great ideas, and we will come out of this. But please share your information with each other and just keep in touch with us as well. But support each other and support our communities. I think we have really strong communities, and we know how to do that.
And I would close with this, so again, as a community, you understand this to me is a very critical point. When we had the task force meeting this past week, not only the three of them, but every elected legislative leader from Madison to DC that represents this area was in the room or they're on the video screen and with their staff. And all of these people are with us too. So even though they're competitors, we have everybody at every level helping us solve this problem. That is something you don't always see. And again, I want to thank all of our legislators, all of the leaders from the medical industry. They realize it's going to take all of us to get through this. So if you would spread one thing, let people know that. Because again, there's a lot of misinformation out there from time to time, and they need to know, more importantly today, this community, this region that we have is going to survive this. We're going to get through it. That is the message I hope you walk away with, understanding more than anything tonight. Again, on behalf of my partners, the chambers, and WEAU, thank you. If you have any questions, just please reach out. We'd be glad to help you understand them.
Thank you, Dave and Ashley and Allison. The impact of the closing decision reaches all corners of our community. Our elected officials have stepped up and in to play an important role in finding answers. We're going to take a few minutes now to talk with our local and our government leaders and lawmakers. And joining us now are Eau Claire City Council President Emily Berge and Chippewa Falls Alderman Jason Heese. Thanks for being with us today. We appreciate it. So, Emily, what is the city prepared to do or is doing to help those affected by these impending closings?
Yeah, thanks for that question, and thanks for having us here tonight. Well, the city, when a large company organization leaves an area, that triggers a national or a statewide response through the Department of Workforce Development. And so they work at the statewide level, which we'll probably hear from our state friends over there soon. But at the local level, we can kind of be their eyes and ears of what's going on, what employers need workers, those relationships. We can just really help, help them be the boots on the ground, really.
Sure. And Jason, how is the Chippewa Falls community going to feel the absence of St. Joseph's Hospital and Prevea?
Well, as you know, St. Joe's is our only hospital in our area. We serve the rural areas north and east and west of the town, the city, excuse me. Our ambulance services the townships. Our ambulance service, will have longer transport times, as the professionals alluded to. We're losing our pharmacy for our fire department. And another thing that is the Libertas Center is right down the road from our St. Joe's. So we're losing that. Basically we're left in no man's land. Our hospital island is going to disappear.
And these, you alluded to this, Emily, too, that these are your neighbors and your friends and your family.
Mm-hmm. Oh, yes, definitely. I mean, that's how I found out, was by text messages from my friends saying that they just lost their job. They found out, through the news. And just, these are real people. And so, we're solving these problems at the macro level, the big level, which is important, but also we have to remember those individuals that are deeply impacted, and that we have to remember that all, which I think we all do remember that, because we are, we do.
we are all here, and I guess that's the thing. And that's, Jason, too, you wanted to let people know that the mayor, Greg Hoffman.
I'm going to stand in tonight because our mayor's not feeling well. Uses HSHS. It's his hospital too. So, but I would just like to thank our medical professionals for stepping up this last 2 weeks. I mean, every day you're seeing something out in the news, their job fair, and they're making an offer. They're looking at this, and we really appreciate that. Again, the city of Chippewa Falls is currently going to be left without a hospital, which is going to add a lot of time. I thank our legislature people for being here and listening too.
All right. Well, thank you both for being here. We appreciate it. And now let's send it over to Alex.
Thank you, Judy, and I'm now being joined by Eau Claire County Administrator Catherine Schaaf and County Board Chair Nancy Coffey. Thank you both much for taking some time out here with us tonight. Catherine, I'll start with you. Just what are some of the programs and services here in Eau Claire County that we rely on here in the county that are going to be affected by the closings of HSHS and Prevea?
There are a number of services, especially in our Human Services Department, and they're critical mandated services that we provide. Typically, any type of emergency psychiatric services are services that the county provides, and HSHS was a major provider of those services. They provided inpatient beds, and those beds were in a shortage position even before this closure, and so that is going to put more pressure on the system and create more work for county, not only DHS, but also for our sheriff's department in transport of those individuals to actually get the care that they need. We heard a little bit earlier about the juvenile psychiatric beds. That is another specialty area that HSHS provided that we will have to find elsewhere. We also depended on them for detox services, and the availability of those services and the problems that will create for our hospital system are numerous, because we'll see more impact and more demand coming through emergency rooms than ever before because of the loss of those services. We also are losing an outpatient clinic, some of our birth to 3 services, and also the human services proponent of work that was provided to schools was actually done through HSHS as well. So those are some of the services that we'll be losing.
And Nancy, obviously this is a massive issue, and there's a lot of different aspects to this, and obviously there's a lot of people that are interested in how we're going to get through this. But from your perspective, just how important is it that everyone in this community kind of works together to get through the upcoming closures of HSHS and Prevea?
Thank you. Our community and Eau Claire County have a great deal of gratitude for HS and Prevea. Many of us have had our children born and our parents pass away at HSHS. We thank HSHS and Prevea for the multitude of services provided to residents in Chippewa Valley and beyond. They have been a great health system partner for our community residents, including those without resources. Our local counties and cities are asking for HSHS and Prevea's help again. We are asking them to use the entire transition timeline to allow community partners to work together collaboratively to ensure continuity of services with the Chippewa Valley for the health and well-being of our residents.
Thank you so much for your time here tonight. Now let's send it back to Judy, who's with Scott Rogers with the Eau Claire Area Chamber of Commerce.
All right, thank you, Alex. We've heard from some of our local leaders, and Scott, would you introduce our panel?
Thank you, Judy. Dave Miner earlier mentioned that we've had 100% participation of our elected officials in this crisis, and we have 3 of them with us tonight. We're pleased to have with us Congressman Derek Van Orden from the 3rd District here in Wisconsin. We have State Senator Jesse James from Altoona and State Representative Jody Emerson from here in Eau Claire. And as we look at this issue, we know that we have been fortunate that our Chippewa Valley delegation in the state legislature, we'll start with you, has worked well on a bipartisan basis on key community priorities. So when we look at this crisis right now and look at what might state government be able to do, what can we expect from our local delegation? We'll start with Senator James.
Well, first and foremost, I want to thank everybody that's here tonight. This is a collective group of people that care about what happens in our area, and all of us care about what's happening. I appreciate the fact that people like to come to us and think that us as legislators can solve the problem, but it's not going to be us solving it. It's not going to be up to the legislature to solve it. It's going to be us collectively, collaboratively, and creating partnerships and relationships to battle what's going on in our side of the state. There's some things that we are looking at collectively. You know, there's funding that Senator Bernier and I had secured for the mental health beds for our area, specifically geared towards HSHS. We were looking to have that partnership with the St. Joseph's Hospital campus in increasing that additional adult and juvenile capacity when it comes to mental health issues and behavioral health issues. So there's $15 million there that we could get creative with. So that's one idea, and then there's other legislative ideas that we're looking at. I'm specifically looking at as well with the phlebotomist issue we might have with law enforcement and what that looks like. I appreciate everybody that's reached out to our office. We're gathering and compiling all the data, and we'll have something eventually to report on potentially as far as legislative issues or ideas moving forward.
Representative Emerson.
Yeah, thanks for that question, Scott, and for bringing us all together. I think you're right. We do have a strong history of working together across the political aisles to make sure that we're producing for the Chippewa Valley. We've seen it with the science building, and this isn't going to be any different. The number of times that I have been down to Senator Smith's office this week, definitely got my steps in because I went up and down the stairs each time. But talking to Jesse and Rob Summerfield, as we see each other in the halls in the Capitol, I found another issue that we need to deal with. This one might be an easy legislative fix, or this is going to be a lot harder for us. And I think the headlines never talk about when we're getting along, but it happens frequently, and we do work collaboratively, and not one person in the legislature can get a bill passed. It takes 132 of us to do it. So that's why we work together. That's why we point things out that we're finding out about, whether it's as simple as, I had a conversation with DSPS about licensing, and a great tip that they had was make sure that people who are license holders don't have a professional email in the system. Make sure that it's a personal email, and passing that around to folks so that when Jesse gets calls from his constituents, he can pass that on as well. And this is just what we do on a regular basis, actually.
So Congressman Van Orden, the federal government has a role here too. So how can both the state and the federal government respond to this issue?
Well, I want to thank everybody I've talked to. I think everybody personally or on Zoom Just for everyone's knowledge, we were given a 2-hour notice that this was taking place. That's myself, Congressman Tom Tiffany, Senator Ron Johnson, and Senator Tammy Baldwin. So we had essentially as much notice as everyone else here, so we're playing catch-up. I want to stress the fact that everyone, from my experience, has taken their jerseys off. There's no R's and D's going on in this problem set, and for some reason, healthcare has become politicized, and it should not. And we are all hands on deck here, and I want to thank the Eau Claire and Chippewa Falls, their city government, the Mayo, Marshfield, Oakleaf has been great, county board supervisors, mayors, police, sheriffs, fire departments, emergency coordinators, public health officials, including the coroner, because we're dealing with the entire spectrum of life from birth until death and everything that can happen in between those two significant milestones in life. And folks have just been very, very open and forthcoming. What we're doing now is we're still in the process of framing the problem. And we're taking a very methodical approach under a compressed timeline because of such late notice. And what that means is right now we're still identifying the services that were provided, because then we're going to know the services that we're going to have to figure out how to help provide, the shortfalls in them. We're going to identify the gap or the delta between those two, and then we're going to have to look for some stopgap measures. I'll give you an example. I have a letter from one of my constituents who is in the process of getting cancer treatment. Okay, her cancer treatment cannot be paused because we can't figure out a solution. So there are folks that are going to have a continuation of services regardless of whether or not these are functioning or not. So that's the stopgap measures that have to take place. And then the next thing is to triage from the most critical services to the least critical services and make some very tough decisions. That's on the state level predominantly, and then with you guys. And how we're posturing my office is this. You guys, my staff is your staff. There's 11 members of my congressional staff in this district, and they're standing by to help with this issue. And this is what we're doing now because it has to be addressed. There are several different programs through the USDA for rural medical care that we're exploring. And what we are doing from the congressional office is we are making sure that we're linked up between Chippewa Falls and Eau Claire, identify any redundancies that they may come up with, and then help prioritize this stuff and then push it forward from our level. So again, thank you very much for putting this on and for all the cooperation on it's not even a bipartisan effort, it's a nonpartisan effort at this point. And I'm very thankful to be here to be able to add some assistance.
So earlier this evening, as we looked at what some of the issues are here, we have certainly the immediate issue of what are we going to do about patients and employees in the community right now. But we did hear about the issue with the reimbursements. Yep. And the fact that Medicare and especially Medicaid underpay what it costs health systems to provide that. So from both a state and a federal level, is there a solution to that? What could we possibly looking at? And that's a broader solution than even our community.
You guys want to do state first?
Yeah, I'll start with that one. So I think this is a situation where Medicare and Medicaid reimbursements have been underfunded for a really long time. We need to do a better job. Healthcare is a business, unfortunately, and we can have a longer discussion about whether we want to keep it a business or not, or do some kind of hybrid version. But, there's not one magic bullet with this. We can't say we need to do this and that's going to change the situation. We definitely need to look at reimbursement rates, but we also need to look at healthcare deserts, and we need to look at the upstream as well. Jesse mentioned the crisis beds for the mental health. We need to make sure we've got more of that, but we also need to make sure that we've got more counselors. And how do we deal with that on a state level so that somebody doesn't get to that crisis level where they need that bed? How do we fund our public health systems better? We do a terrible job of that in Wisconsin. We fund our public health lower than a lot of other states, and that's going to include not just immunizations, but also increasing movement for everybody and doing things that we've seen in our community that encourage people to live healthier lifestyles. Our farmers market is a phenomenal job, and we see people eating healthier because of that. How can we continue that into the winter months? What can we do to turn the conversation into a health discussion and not an illness discussion? Those are the long-term conversations that we need to have, but we also need to do some Band-Aid fixes. And part of that is looking at our Medicaid and Medicare reimbursement rates. I think I would be kicked out of my party if I didn't mention the fact that, Medicaid expansion is a part of that solution too. But that's not the only solution, and we can't just say this is the one thing that will fix it, but it does need to happen because we've had a lot of people who are underinsured. And then if you're making barely over minimum wage, but you've got a $10,000 deductible, you're not going to go and get your basic health needs taken care of until it's at a critical access point. And by the way, we're closing ERs and, things like that, and that's just going to create a bigger problem too.
Senator James, any thoughts on the reimbursements?
Well, again, there has to be discussion. Right now in our state, there is no coverage gap when it comes to health coverage. I'm sure this is going to be the context. The governor was here last Wednesday morning saying if we had the Medicaid expansion, it would have prevented the closure of the hospital. I don't know if it was a clear and accurate statement. The Medicaid expansion does not go directly to the hospitals. It goes into the marketplace. So could it assist it in certain ways? Absolutely. Is it the cure-all to be end-all? I don't believe so. And financially speaking, and from a fiscally responsible element, looking long-term, if that is the exact answer to this problem, why haven't we done it at this point? And it's because we don't have the coverage. Wisconsin's done it uniquely different than other states. And so in our Republican side, in having leadership or having the majority now, it's a non-starter within our leadership.
So if Medicaid is going to make a larger reimbursement, the money has to come from somewhere too. And we'll go to Congressman Van Orden, and we're running a little tight on time, but is this coming up in Congress? Is this something you're hearing from your colleagues or other communities about the reimbursement
I'll give you a
rates?
TV answer, yes.
Okay.
Across the board, I'm on the Veterans Affairs Committee, and community care, we've got 6% about of the patient load is veterans. That the VA can absorb that. So I checked into that already. I'm okay with that patient stuff. They get Medicaid reimbursement rates. People fall out of community care because they don't think it's enough. I understand that. The 5-meter target for us right now is inflation. Inflation is predicated on the incredibly high energy costs. Mm-hmm. That's just a fact. If we lower inflation, these healthcare costs are going to go down. We need transparency in healthcare cost pricing. People need to be able to decide where they want to get. If it costs $1,500 for an IV here and $400 for an IV here, I'm going over here because it's the same treatment, it's the same care. So that's got to happen, and that was happening under the previous administration. Generic prescription drugs. Okay, when things get to the point where they've gotten to the point where they can be issued as generic drugs, they have to be issued as generic drugs. It's foolish to think that we should be paying these exorbitant rates for something that you can readily available purchase in Canada or Mexico for 1/3 of the price. So does this come up frequently? Yes, but I will say this, expanding Medicaid to more people, if the Medicaid system is broken right now, is just going to make it more broken. So that is not the solution. It sounds like it is, but it isn't. So throwing more people on a sinking ship is not the right answer. But this comes up frequently. Unfortunately, I'm not in a committee of jurisdiction for this other than VA, and that's where I tend to focus myself, is making sure that we have adequate care for our veterans, because I can directly affect that. But yes, I hate to break it to you, but Republicans are not heartless. And we have children, and we get sick, and we want to make sure that our kids and our families are taken care of also. So we do work diligently. If you guys ever have any questions, about this, please reach my office at vanorden.house.gov, and I'd love to speak to you in person about it.
And we know it's a complicated issue, and we appreciate that you're all looking at solutions and looking at the issue.
Again, Alex has a question from the community.
There were several questions from the community asking what government can do to help in this situation. One question asking, if hospitals are failing, why can't the government help or take over like FEMA, similar to helping a community that's been devastated by a tornado? Congressman Van Orden, if you could address that. Is that a possibility?
I'd love to answer that question. I lived in Germany for 3 years, and we have 2 children with very significant orthopedic issues. And what you hear in the news is not true. We had something called Champus. It's essentially military health care. So even though this was public health and everybody's paying into the system, you get preferential treatment. So there'll be 5 people in a room that have private health care that if you make a certain amount of money in the country of Germany, you're obligated to buy and continue to pay into the service, into the public service. And then there's a group of 150 people in the same orthopedic office. So what you're hearing is not true. I encourage you to look into this or go live in another country that has public health. Public health has been proven around the world to be disastrous. It simply does not work. That's why people from Canada come to the United States for health care. And the cost for prescription drugs doesn't work for the United States. That's why people from the United States go to Canada. So it's not a one-stop shop, but it has been proven. And if you go to these countries, unless you want to pay 60% income tax, which is what you will, and you will not get a refund, you're not going to have public health. It simply does not work because we are learning now there is a finite amount of services. If you guys learn anything from this, there are a finite amount of medical services available. And that means that if you open everything up to everybody without having to pay for it, you're going to have to start rationing health care. And I do not want to see that in the United States.
We had another question tonight. From a viewer named Sheldon who wrote, if hospitals can't be profitable, the government needs to take over, county, state, etc. If we let the hospitals close, it'll take years to recruit doctors and nurses. Is that something that could happen here in Wisconsin? If any of our state representatives could comment on that.
Yeah, like I said earlier, right now in this country, healthcare is a business. But we as the government also need to be the safety net for things. And we do this in all kinds of situations. And so some of the things that we've been throwing ideas around, not necessarily at a bill level yet or anything, but just how can we think outside of the box for this? And so what are some of the situations that are maybe harder for commercial insurances to cover? So mental health, substance use disorders, things like that are people who maybe are already on Medicaid anyways. Is there a way that we can kind of set up a centralized regional approach to that in our area that would help cut down on maybe local government costs with transporting people across the state to a different facility, but to have that wraparound services right there too. When we're looking at this, it's great that we've got healthcare providers and elected officials at the table. When we're having these conversations, we also need to bring in people who are impacted. I can't tell you what a cancer patient needs because I'm not a cancer patient. I can't tell you what a family who is going through mental health services right now needs. We need to have those conversations with them as well as with the medical professionals and devise some services off of that as well.
Anything to add, Senator? Anything to that?
Well, I don't necessarily know if having the government run a healthcare system is appropriate. And how would our colleagues feel about that if they're being run by myself that is elected representative of the government and telling them what to do? I don't think that's the avenue that we should even look at or take. Let the professionals that are trained to do this do it without any government interference. We're here to help legislatively. What do? We craft legislation to help. So I think that's the avenue that we need to continue to look at and then help with the dollars at the state level through the legislature, through the Joint Finance Committee as we navigate this forward.
And if I can just clarify real quick, what I was talking about is not necessarily having the state take over the healthcare system. I'm talking about, is there a way that we can do another Winnebago hospital, another Mendota hospital, something like that where we already know that there's a high need for this in the area. And I know these are conversations that we need to continue on. Yeah.
And we're having these discussions.
Yes.
Yes, thank you so much for all of your input. We really appreciate it. We do have a couple of minutes left. I would like to, they've been very patient over here talking about the the Medicare reimbursement, the Medicaid reimbursement, and that type of thing. But somebody else was mentioned in our community questions. How will the healthcare systems remaining handle a major event like COVID, like a catastrophic event, if we can't get these, especially emergency rooms, going? Is there something that someone could answer to that question?
I can start. So it is back to that flexibility. And so we have the structures that we can stand up to respond to an event like that. So we use our incident command structure where we get the appropriate leaders in place, the right team members, those that have the subject matter expertise, and then we problem solve, and we meet frequently, and depending on what the issue is, we bring more people in, and then day by day you keep working at it, developing the plan, and then working your plan. So it is really having that rigor around structure to analyze a problem and then put some action around it.
Mm-hmm. And we talked a lot tonight about coming together. I mean, you all came here tonight, and I think that's, incredible. So how do you work together as we move forward here?
So I would say during COVID, all of us used to meet almost weekly to go over what was going on at each of our hospitals, what we had as far as equipment and that sort of thing. And I think all of us have been in communication through these couple of weeks, and we'll continue to work together to see how we can help solve this problem.
Right. And is it a problem that can be solved very easily?
It's an extremely complex problem, without a doubt. And it's a problem that communities across our country are facing with rural health care. And trying to balance that access, the cost, and the quality triangle, if you will, in healthcare is extremely, extremely complex. So is it a problem that we can solve? I think, given what this community has done through a really, really difficult time during COVID and the lessons learned, I would put my money on this community any day of the week. But will it be easy? No. It's going to take a lot of partnerships, as others have said. It's going to take a lot of collaboration. It's going to take a lot of effort.
Right, and some creativity, it sounds like, too, as we move along with all of this as well. I think we are getting ready to wrap things up here from the RCU Theater and on WEAU. Obviously, a lot of issues to untangle here. We're not going to do this tonight. This is a first step. This is a first dialogue. We want to thank you all for coming in tonight, for watching. Everyone here on the stage and in the audience, and the Pablo Center for allowing us to be here, a beautiful venue. Thank you all for watching on WEAU and on our streaming services. Again, the conversation is far from over, but as a community, again, we will work together, and we will help each other through this. We'll see you next on WEAU 13 News at 10. Have a good night.